lovely to be here presenting the latest podcast in front of a 33-foot long piece of artwork, which is one of 3 pieces of artwork that Stockport College art students have provided for us. It will hopefully be a delight to our patients and their families when they come to visit our inpatients, and it's a huge thank you to the college students and to the college for supporting us in this piece of community work. So thank you to them, and I hope that if you get the opportunity to come into the hospital, you will be able to come and look at the artwork yourself. We have recently launched to our staff and to members of the public and our stakeholders our very latest 5-year strategy. It was essential that we really looked at the strategy for the organisation because of the number of changes that are happening within Greater Manchester and in Stockport and the High Peak. There are a number of big partnerships such as Stockport Together, the Council's very own plan in Stockport, Healthier Together in Greater Manchester, and what we need to do for the patients that we serve for Stockport into the High Peak and Cheshire. This strategy looks very much at what would be those services that we should focus upon. And having done some considerable analysis using health economists who are specialists in this area, the Board of Directors has concluded that the 2 key areas of focus are around looking after elderly patients, absolutely in the round, whether that is for a surgical or for a medical type condition, and also for cancer patients. There's going to be a big change for our 800 staff in Tameside and Glossop Community Services. You may know that there's been a lot of work undertaken around looking at the future financial and clinical sustainability for Tameside Foundation Trust. And as part of that partnership work with Tameside Council, with Derbyshire Council, and with the Clinical Commissioning Group in Tameside and Glossop, it's been agreed that the organisation should move into what's called an integrated care organisation, using Tameside Trust as the vehicle for actually building upon the framework of the Foundation Trust. Now, what makes sense is that community services are from the very start part of that integrated care organisation. And so it's about putting our staff where they really can make the most difference to patients. And so the Tameside and Glossop community staff, 800 strong, are going to be moving from April 2016 first into Tameside Foundation Trust and then into this new integrated care organisation. It's essential that community staff are part of the design of those new pathways that are going to make sure that the patients who need health and social care in Tameside and Glossop have the very best opportunities for the best outcomes. And I just wanted to take this opportunity to say a huge thank you to those 800 staff in Tameside and Glossop. It's been a real privilege over the last 4 years to have managed this exemplary service, and we will be working with them up until the point of transfer, and then absolutely as a neighbouring trust in partnership with them going forward. Big thank you to them. Accident and emergency services continue to be provided as much as possible in a speedy way in this organisation, but unfortunately we've continued to have difficulties in providing these services on a sustainable basis against the 4-hour wait standard for 95% of the people we see and treat. A lot of work is going into this. We're working closely with both the Council and with the Clinical Commissioning Group and Primary Care to make the differences that are needed. And we have got currently a 90-day plan to look at how we can further improve flow of patients who come in through accident and emergency into the hospital to ensure that if they do need to be admitted, there is a bed to be admitted to in a timely fashion. but also to give our general practitioners the ability to be able to send people into the hospital for diagnosis and assessment in a smarter way that doesn't mean that they have to go through accident and emergency, but indeed can go straight to the point of diagnosis and assessment. We have an inspection on an annual basis that's called PLACE, and it's about ensuring that the environment and the offerings we give to patients, other than the clinical ones, are of the right standard. And I'm pleased to say that in terms of food and hydration, we were judged to be better than the national average. Unfortunately, and very unusually for us, there were 4 areas where we were below national average. And that's around some important areas such as cleanliness, privacy and dignity, coping with dementia areas, and the environment. I'm really disappointed in those, and we've already got the key facilities and estates team working with the nursing staff to ensure that that is soon put right. We've got some very detailed actions taking place, and I'm hoping that when we again are looked at independently for that inspection next spring, the situation will be much improved. In the meantime, because next spring is still a long way off, we've got our own internal place inspections, and we're doing that with help from Health Watch, from governors, and from staff from other departments within the hospital. So we will get better in those areas, but it's pleasing to see that in food and hydration we were doing well. There was a very important business case that came to the Board of Directors at its last meeting, and that was to look at an electronic patient record business case. This is a multi-million pound investment which will take about 2 years to implement, and I'm pleased to say that the board recognised the benefits both for patient care and the ability to support improved outcomes and of safety, but also it made our staff able to work more efficiently and effectively in terms of the care that they're giving. Essentially, it's one big record that then has the ability to communicate not just within the hospital, but out with other hospitals who perhaps partner with us, and most importantly with people who actually refer patients, the general practitioners and therapists who refer patients into our hospital. We've currently got about 12,000 public members, and then our 6,000 staff are members. So it's a big number of people in Stockport, High Peak and Cheshire who are members of the organisation. But what we want to do is encourage more people who want to be involved in the future direction of the Trust to join as a member. And I wish everybody good luck in Members Week, but this is something that really goes on 52 weeks of the year. And finally, it's the start of the academic year, and we've got 3 new youth ambassadors. It's a fantastic opportunity. It is a bit of an exemplar that other organisations have come and looked at, because every year we have some key youth ambassadors who want to become involved in not only giving the perspective of the younger person into what we're doing in the organisation, but also becoming the ambassadors of what the organisation's doing back out into the community. Because of course we are a significant employer, and we want to work with young people out with the organisation to let them know the career opportunities that they could have working in the future within the organisation. So thank you to the 3 youth ambassadors for giving up their time to do this really important work.